I'm sure people who are supposed to be here will come, get in. So here we are, week 2. And as I just said, all of a sudden it's going to be week 10 and you're almost to HESI. It goes by pretty quick. Again, keep up with the work so you don't get behind. This week we do have the first quiz. I told you, wait till after class this week to do it. I do cover everything, whether it's in the lecture, the PowerPoint, or it's going to be in the Kahoot, some of the concepts. There are a couple questions on Piaget, so pay attention to them, okay, as we go over them. It's just understanding the way children think. It's cognitive awareness, and that's all about thinking. We are going to be going over infants, toddlers, and preschoolers, chapters 31, 32, 33. I'll be doing that. And when that's followed up, I'm going to do a Kahoots. The Kahoots is 55 questions. And I do start making bigger ones when we get into the chapters with the meat and the potatoes, because these are the concepts you need to know. Okay, you can just say hello and then you got to leave.
Do you have glasses for me? I need like sunglasses.
Sunglasses?
Yeah.
In the car.
Yeah, I need it.
And there's some on the counter for you. So say hello. That's
Hi.
Christian.
Hello.
This is who I'm going to be talking about all the time. So you're going to let me teach now, okay? Thank you. Love you. Got to get to you, and they got to give them their love, and let's get what they want. So the Kahoots, as I was saying, very important. Even this week, which is the beginning of the semester, I've gone and looked at the HESIs from last semester and looked at those areas that were a little weak. And I have made sure that those areas, I've put those concepts into the Kahoots. I work hard at it. I also make sure that I change the slides, the PowerPoints, to make sure you get what you need. Making sure it's not that I didn't give it to you. Maybe it wasn't explained good enough.
Which counter? Which counter?
The kitchen counter, the tall one. Keep them out there, please, so I can teach these poor people here. They don't need to be seeing Christian all night. All right, let's go ahead and let's get to the PowerPoint. So starting with infants, I think the miracle of life is the first year of life. You go from 7 pounds, let's say, at birth. By 1 year old, you are triple your birth weight. You're 21 pounds. You go from not being able to lift your head to walking and running. I think that's amazing. And the way that they do it is the central nervous system is growing and it's sparking muscles and it's, promoting muscle development and getting stronger. And it's the eyes being able to see and the hearing and the taste get better and the heart and the lungs just start to get bigger and to be more efficient. It's quite amazing how quickly they grow. And the reason why we look at weights is we're seeing if the child is not gaining enough weight, we know they're not getting enough nutrition. And if they're not getting enough nutrition, how can they grow the way they're supposed to? They're going to be cognitively delayed. So that height and weight is an important thing that we do, not just because you want to see how quick they're getting as a parent, but as a healthcare professional, we need to know to see if they're getting proper nutrition. So as I said, as they get older, their heart rate, respiratory rate starts to slow up. At birth, infant's heart rate, 140 to 160. Respiratory rate is 40 to 60. As we get older, we're going to see the blood goes from mommy's good blood, hemoglobin hematocrit. But initially, the infant does not make its own blood cells. So they die. So by the time the child's about 3 to 6 months old, hemoglobin hematocrits could be like 9 and 27. It could be 8 and 24. And this is normal. Then all of a sudden, the body starts to make its own blood cells, and then it catches up and gets the hemoglobin hematocrit where it should. Also, we know that happens with the immune system, where initially you have mommy's good immune system, but again, that it also fades off and it's not as potent, and the baby has to make its own immune system. You're wondering, why do we give immunizations 2, 4, 6 months? Did you open the book? Did you see those 2 pages of like 100,000, it seems, immunizations? You're like, now, how am I going to remember this? Well, I'm going to make you understand those key ones that you have to know. Hepatitis B, first one, before they get out of the hospital. That's always something that we look at. But 2, 4, 6 months, we're giving them all of those bad diseases immunizations because an infant does not have the immune system to fight it. Now their head, we know, is born, it's big, it's bigger than their chest. And we know that because as they get older, now we're going to see the head get, smaller and the chest gets equal to or bigger too. But when they're born, they have 2 fontanelles. They have the anterior and the posterior fontanelle. Now the anterior fontanelle closes the latest, about 12 to 18 months, and the posterior 6 to 8 weeks. Now, why do we need to know numbers like that? Well, what if they close too quickly? Can the head grow? Can it get the way it should, the brain? No. So if it's closing too quickly, we need to do an intervention to give that brain that area to be able to grow and to be where it needs to be. Conversely, what if it's still open at 3 years old? Why? What happened? Is there a fluid on the brain? Hydrocephalus? Is there a tumor? Something's not right. And now our brain is not protected, right? Because that nice cranium isn't covering that brain. So knowing these things, then we have to do, what do we need to do for the child? What does that child need from us? That's why we learn all of these little things about grasping and fine and gross motors, and so we can catch them up and protect the child. At birth, they don't hear as well, they don't see as well. They call it binocular vision, which means one eye and the other eye, they don't work together. We know if we put our finger up and we look at a point somewhere, one eye is going to be the one that's going to be looking there, but they both will get there. And what does that do? It gives us depth perception. When they're working individually, we don't see it. As they get older, about after age 1, you're going to see them working together and depth perception gets better. Now, as I said, central nervous system grows quick. That's why nutrition is needed, because the central nervous system has nerves, which sparks muscles, which go with movement, which goes with grasping. And all of these movements actually are the brain thinking, I have hands, they move, look, ooh, my mouth, I like them, they eat. Oh, here's a rattle, I can move it. It's starting to think and putting things together. So all of those things depend on good nutrition so that the central nervous system can grow at a good rate, get that proper, energy and gasoline that it needs to get where it needs to go. As I said, the immune system is mommy's at first, and it takes that first year of life, not only getting all of those immunizations, but children are going to get sick. They're going to get little colds, little viruses. I think that breast milk, and it's something my daughter taught for this little guy that you just met. She was very into breastfeeding. She reads and reads and reads. She's one of those sort of people. She wants to know. She loves information. So she read about it and she said, well, Mom, if I get sick, I'm develop antibodies, and that's going to go through the milk to my son. So if I'm getting sick and they're drinking my milk, they're not going to get sick because I'm giving them protection. And I didn't really understand it that way. So we learn from everywhere, don't we? At birth, sometimes they're born with this cheese, I call it, that vernix caseosa. And I found a really good picture, which really shows how really good it can be. And that actually protects the body. It's an immune defense at first. We know that their intestines have stuff that respond and help them with immune system. There's so many things that naturally are there with these infants to protect them. At birth, the baby's born. First thing we do is put them underneath a radiant warmer because they cannot hold any heat at all. And when they come out of mom, whether it's through C-section or vaginal delivery, they are wet. And they will, through the air, get cold quickly. So sticking them underneath those warmers is very important. When they go home, they're going to be needing like an extra t-shirt or an extra blanket at first, because they cannot maintain their own body temperature. But as they start getting bigger and get those little pudgy little cheeks and those pudgy thighs, now we've got all that protection, which can hold their own heat. The kidneys. Now, how do we know if the kidneys are working correctly? Well, in the adult world, they say 30 mLs per hour is the lowest urinary output, right? That's your given. Kids aren't like that, right? It's either like medicines, milligrams, micrograms per kilogram. Well, so is urinary output. We know the minimum of urinary output an infant should have, children should have, is 0.5 mLs per kilogram per hour. That's just like the overall 30 mLs that you would have with adults. Now, how do we measure urine in infants? They go in a diaper, so how do you do that? Well, usually your #1 diapers weigh 30 grams when they're dry. You take it off the infant, and let's say that diaper now weighs 60 grams. So the difference is 30 grams of weight. Well, 1 gram is 1 ml. That is 30 mLs of urine. And it's actually very accurate. And that's how we measure urinary output, intake and output, very, very carefully with children, just by measuring diapers. And we count the stool-like output, okay? Now, at birth, infants, their GI system cannot tolerate anything but the iron fortified formula or breast milk. Whatever else that you put in their bodies is going to come right out in their stool. Many times you will see us add some cereal into their formula or their breast milk when they have reflux. It makes it heavy and it holds it down. You're going to see the cereal in the stool because it's not going to be absorbed and utilized, but it's there to make the stuff thicker so we keep in that milk instead of having that little spit up. So there's 2 types of motor development. Fingers are fine. F, fine, fingers, okay? So fingers are what is fine motor development. Everything you do with your hands, whether it is reflex palmar, whether it is voluntary, whether it is a pincer, putting blocks, doing things with the hands, buttoning a button, tying a shoelace, these are all fine motor skills. So the first one that we do is a reflex palmar grasp. And then it goes into a voluntary. Then it's going to go into that pincer grasp. But at first, it's like put the kid in a high chair, put some little Cheerios or those little puffs out there. They take their hands and sort of smush it. So it's sort of a pincer, but it's screwed. As they get older, they'll take one at a time very neatly and get one of them, right? And that's about the fine one by about 10 months. As they get older, removing objects from a container is about 11 months, and then building a tower of 2 is 1 year. Now, if you have children, don't think about what your kids do. Think about what the book says, because they're all different. And that's why I love pediatrics. As long as they're doing the sequence of events that they should, this is what we want to see. Again, that'll be a test as you go through it, and you can look at the PowerPoint. Gross motor, get up and go, go, go. This is running. This is turning over. This is lifting their head up. This is all motor things. You use your muscles for these things. So gross motor is get up and go, go, go. First thing that happens, we lift our head up. Then we roll over from our front to our back, and then our back to our front. At 8 months old, they should be able to sit unsupported, like no pillows and stuff, holding them up and keeping them up. By 10 months old, they can go from their tummies and they can get up and they can sit up. So they're getting more independent and moving more. Now, why do we need to know these numbers again, right? Well, if they are not doing what they're supposed to do by a certain time, we need to find out why. Children are the most resilient of all humans. I think they're the strongest humans on the planet. And it's one of the reasons why I love working with them. And if you institute early intervention, whether it's speech therapy, occupational therapy, physical therapy, they catch up so quick. And it was like they were never delayed at all. Also, if I know an infant rolling over front to back by 6 months old, am I going to let them sit on the couch unsupported by themselves? Am I going to sit them on the changing table with no belt on, let them there? Oh no, what's going to happen? And I've seen it, I can't tell you how many times. I turned around, got a diaper, and the kid was on the floor crying. They fall off and they hurt their heads, and they get bruises. And of course, parents are, they're very upset that that happened. I've seen actually a premature infant on a scale being weighed. The nurse turned to make the crib and put a blanket on the crib mattress, turned around, and the baby was on the floor. And that's a premature infant. So we really need to know when kids do things so that we can protect them from any sort of thing. That's safety. So the first 6 months of life, all they're going to drink is breast milk or iron fortified formula. After 6 months, we will start to introduce foods. Now, do they introduce cereals, fruits, vegetables? That's really up to the pediatrician. Many of them start with the cereals and then add fruits and then vegetables. Some people think, well, vegetables don't taste as good as fruits, so do vegetables first. It is all up to the physician and the parent. The only thing is, one food introduced at a time, and you have to wait 4 to 7 days in between each introduction of a new food. And sometimes an allergy could be as simple as rashes, or it could be vomiting, it could be diarrhea, or it could be colicking pain, and diaper rash. It actually could come up to be. So looking closely at that infant and making sure that they're tolerating food is important. Now, at birth, they're born, they're 7 pounds. They've been floating around in mommy's amniotic fluid. And when they come out about 2 hours later, you're going to see those puffy eyes. They're not going to be puffy anymore. They just urinate and they get rid of all this extra edema, that this fluid that they were floating around is. They lose up to 10% of their body weight, normal. But then they start gaining weight. And as I said, they triple the birth weight within the first year of life. Many times you'll send a parent home from newborn ICU where, the infant was there and, we're measuring very carefully the amount of formula or breast milk going into the infant. And then mom goes, well, how do I know? I'm just now nursing. How do I know how much milk they have gotten? And it's really an issue. And I go, if your diapers are 6 to 8 wet diapers, and it doesn't matter urine or stool, the baby's getting enough to drink. And it's as simple as that. And they're like, oh, okay, yeah, the baby has a lot of wet diapers. I said, then you're good. And we know breastfed infants do need some vitamin D, and vitamin D helps with muscle development, etc. So that second 6 months, these are the foods we introduce. And as I said, it depends on, the physician and even the parents, what they want. We do not give whole milk until 12 months old. And then they don't have to be on formula or breast milk. Many parents decide to keep them on, the breast milk, which is fine. If the infant wants it, of course, keep it. But you can switch to whole milk. Not skim milk, not 2%, whole milk at 12 months. Now, babies start to get teeth and they come in all differently. I had these kids who didn't do anything the way they should have. My 2 children, my son, my daughter, and this little grandson here, they never got a tooth up to a year old. At 15 months, they got 6, all at the same time. So they do say that if a child is 8 months old, you should minus the number 6, they should have 2 teeth. But it doesn't mean that they're behind if they don't, okay? The one thing to be careful with is how to take care of those teeth. And you could just take a warm washcloth, just water, and rub off the teeth at night before they go to bed. So you get rid of those extra carbohydrates from the milk, get it off their teeth so that they don't rot. No toothpaste, they don't need it. And if you're going to use a toothbrush, those really soft ones made for infants. And you can add that fluoride at 6 months. One of the things that is recommended is you shouldn't take a bottle and prop it up. I mean, this is easy if you have one child. If you have twins or triplets, it might be harder, but it shouldn't be. They don't want milk and bottles in the crib, and especially not fruit juice. And they say pacifiers are actually good, because we know infants, children explore the world through their mouth, and they self-soothe in their mouth. So a pacifier, they have said, is good, and it actually helps decrease SIDS death. Infants sleep a lot. They eat, they sleep, they pee, they poop. They eat, they sleep, they pee, and they poop. And they're up a little bit of time, and that's the time that we're going to put them on tummy time. And the tummy time is important because today we say back to sleep to prevent SIDS death. And that creates a flat head. And many parents get concerned, but my kid's head is flat. Well, if you notice, kids, their heads, infants, they're very soft and they're very moldable and malleable. So getting them just up on that tummy time where their head is up when they're wide awake and alert, that's all they need for that head to get better. They say you don't need walkers and swings and playpens. And we've all used them. We put them in the swings because it'll help them go to sleep, or if they have gas, it helps them relieve it. But the book says you don't need them. These are all your vaccinations. As I said, 2, 4, 6 months and 15, 18 months, you're giving a lot of immunizations on this child because you're building up their immune system. As I said, Hep B is given in the hospital or at least the first visit to the doctor. Now, the one thing with immunizations is just like adults, immunosuppressed children or children on steroids that they're considered immunosuppressed cannot get a live vaccine like chickenpox. Same thing that you would do for adults that way, you're going to do for children also. If you've ever known a parent who has a child with colic, it is a very difficult thing for parents because these kids never sleep, they're always crying. And these poor mothers and fathers are exhausted because this kid is full of gas, even with some methicone drops, and even with rocking them and bouncing them and burping them and decreasing feeds, et cetera, et cetera, et cetera. Sometimes they have colic. Before they get to be a year old, it's gone. It's usually lasts only a couple months, but it is exhausting. Another thing that we have found is that failure to thrive, this growth failure. Well, how would we know if you have that? Well, if you're born at 7 pounds and at 6 months, you only weigh 10 pounds, you're not gaining enough weight. You should be 14 pounds. You should double your weight, which means what? You're not getting proper nutrition. You're not feeding that central nervous system. You're not giving that nervous system and muscles and, cognitive awareness. It's all not there because of no nutrition. So failure to thrive, we take very seriously. We do all sorts of things to find out. Is it metabolic? Is it a food allergy? We go through a whole rigmarole of testing to find out why, because gaining weight on children, infants, is very important because they need their nutrition. A couple other things they get is, I've already talked about positional plagiocephaly, which means that flat head, where just on tummy time, have them up. They can sit up when they're wide awake and alert, and that will help. Dermatitis or diaper rash. This could be due to not changing a diaper, frequently enough. It could be due to a food allergy. I found it due to the brand of diapers that I used. My grandson could not use Huggy diapers, only Pampers. That's it. You put on one Huggy on that child or a different brand, and he would look like that in one day. Put him in Pampers, he never had another rash. My children liked the cheap brand from the grocery store. They didn't like Publix. They had Publix brands down here, but they didn't like Huggies. They didn't like Pampers, and they would look like that in these more expensive diapers. So, you know, that's one thing that as nurses, parents are going to say, what can you do? Well, this one actually sort of looks like a yeast infection. So keeping it open, keeping it clean, keeping it dry, just washing it with warm water helps keep it, from getting, urine on it, because it will burn. And then of course, some sort of nice fat and cream or powder or something. Another thing that happens is cradle cap. Many times we like little girls with big bows and, those big headbands, and they're just so cute. And then you've got this scalp that is all, flaky. It's like, ooh, you don't want to pay attention to it, right? You don't want to draw that attention. So how do we treat it? Well, you wash it just like you would with shampoo and water, and then maybe some sort of mineral oil, make it moist, and then a fine tooth comb, just gently, and eventually that cradle cap will go away. SIDS death. There's been a lot of research done on SIDS, and the hospital that I work with down here has been doing a program for the last 20 years looking at SIDS deaths, and they have gone from, positioning has changed a lot. Now it's just back to sleep on your back. They found through looking at their premature infants when they went home, they're looking at that research. The amount of SIDS deaths has drastically decreased with just having them on their back. Now, how do we, know risk factors? Well, with all this research, we have found that males are more apt to SIDS death than females. We know that if there's smoking in the house, if they're overheated, if they've just had a little upper respiratory infection, a little bit of, nasal mucus, these things can cause SIDS deaths. Infants don't realize they have a mouth to breathe out of. They only breathe out of their noses. So that's as they get older, they realize that they have a mouth. So if their nose is clogged up with little mucus, they're not going to be breathing as good. So they also found that breastfed infants have a decrease in SIDS death. So knowing these risk factors, can help a parent, prevent SIDS death, keeping them on their back to go to sleep, giving them their pacifier. If they're breastfed, continue those breastfeeds, not overheating and no smoking in the house, et cetera, et cetera. These all things can help decrease it. Another thing that can happen is something called ALT, is what we call it. Apparent life-threatening event is when a child coughs and chokes and holds their breath and turns blue. It could be reflux that's going up and the kid goes, can't breathe and turns blue. And these parents, of course, bring these infants in immediately. We take it seriously, and these children are admitted and they do these complete workups. They do a GI workup, seeing if it is reflux or GERD, or they're going to be doing the brain, looking, could it have been a seizure? And they will be doing all these examinations prior to discharge. Once this infant is discharged, because they've had this event, they'll be discharged on an apnea monitor. And these apnea monitors are easy to put on. It's a piece of cloth with Velcro with two little leads, and it looks at heart rate, respiratory rate. And when it gets too low, it is the loudest ear-piercing sound that wakes up the infant and, of course, the parents. So, question. Letitia is a breastfed infant being seen at the clinic for a 6-month checkup. The mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Like, why is she doing that?
See.
Absolutely normal. Because again, remember, infants explore the world through their mouth, number one, and they self-soothe. They take away their own stress with their mouth, sucking whatever is there. Good, thank you. So let's go into some theorists. Let's go into Erickson. So in your, upcoming exams and HESIs and NCLEX, they like to talk about some of these theorists. Erickson is a big one. Erickson in infants, Erickson in school age are the two ones I've seen the most of the time, and Piaget, and we'll talk about him too. So Erickson talks about trust versus mistrust with an infant. What is trust? What does it mean? It means that if an infant cries, he knows somebody's going to come and take care of their needs, whether it is changing their diaper, feeding them, holding them, or burping them. Their needs are met. They cry, somebody comes. Mistrust is those situations where parents do not pick up their children when they're crying. It could be there's just a lot of kids in the house and they can't get to them quick enough. Or it could be someone with drug use, alcohol use, that don't pay as much attention to their children, which I'm sorry, it happens. These children, they cry, and nobody comes. And that's mistrust. So trust, kid is happy. Somebody's going to come. They know they're there. They're even tempered because they're happy, because they know their needs are going to be met. Conversely, the other child is not going to be happy because their needs are not being met. And if they're met, it's not consistent. So Piaget talks about many different things. He talks about the sensor motor. Now, sense is the touch. What does it feel like? Ori, which is oral, everything explored in the mouth, and then movement, motor, okay? And it's using those things to build cognitive development. Pre-operational, what it does, this is how a child is shown something. It's concrete. They can see it. They can touch it. It's here's a car, here's wheels. If you roll it, it will move, okay? Here's my finger. It got in my mouth once and it was like, oh, I enjoyed that. And they do it again by themselves. It is concrete. They know it. They don't have any logic. They don't understand the reasons why yet. They just see it. They know it. Concrete is when there's more logic behind it, as in knowing that this is a car that moves and this is a truck that has wheels, that one does too. It's getting the logic, something different can work the same. It's becoming more logical. Again, primary circular reactions, part of the sensory or motor. Again, found the thumb, started sucking on it, repeated it another time because, it was pleasurable, it was good. I enjoyed that because I couldn't find my pacifier, right? And then as they get older, they learn if they're imitating, they're playing, they're doing other, the adults are doing, they're getting good responses, they're going to do it some more. They do these schemas, they're called about. The schema is what you do in order to do that final action. Like I was looking at it, I tried to get it. Oh, I reached it, I grabbed it. Now I picked up a rattle. When I picked it up, I heard a noise. Now I shake it. This is all how children are learning. Object permanence, we talked a little bit last week, talks about even if a toy is hidden, if they've seen it, they know it's still there. That object is still permanent in their brain and they're going to find it. As an infant, it could be behind another toy. They know it's there. They're going to go look for it. A one-year-old, you put their toys in the toy box, right? Their car is there, their doll is there. Well, they know that even though they can't see it, they know it's in the toy box. They can go grab it. They start looking at their body. They start, taking their hands in the mouth, feet in the mouth. They're exploring their body through, it's playing. I'm playing with my feet. Ever see a kid with his feet up in the air, both of them in their mouth? It's like, how did you reach it? But they're flexible still. And we know, put them in front of a mirror, they are going to try to grasp it, and they're going to look at it and make faces at it. Social development, we know that young children can be afraid of strangers. Is that stranger danger? And that stranger danger is they don't want to go to somebody they don't know. So they cling on to mom and dad. As they get older, though, they're going to start peeking. They say at about 9 months, go peek, are they still there? And actually it becomes more of a game. Like, are they still there? Are they still trying? And we know children, when we have to take them to daycare the first time, but they're 3 months or 4 months old, and they have to go to daycare and you have to leave them there, your kid's gonna cry. They feel that separation anxiety because that's a stranger you had to give them to. Their language continues to develop. What's their first language? Cooing and crying, right? Those are our first language. They start to play. Play is a biggest part of children's life. And we can look at temperament by many ways. So he said, a child whose needs are met with trust, they're going to be the happier child. And there are sorts of, questionnaires, et cetera, that we can do to look at that also. But we can tell if a kid's happy. If they're not crying all the time and they're cooing and smiling at you, it's a happy baby. So now the toddler. I love toddlers, ages 1 to 3. I think they're difficult. I think they're rambunctious. And I like what Seinfeld says. Having a 2-year-old is like having a blender without a lid on. Have the lid off, turn the blender on, and it goes everywhere. A toddler is into everything everywhere. It's quite, they're exploring the world everywhere. It's called intense exploration. So we have to keep these children safe. They have temper tantrums. They're all about me, mine, mine, mine. No. Those are the words that they're knowing now. At the end of 1 year, they speak one word, but when they get to toddlers, they're starting to say a little bit more. Their weight slows down drastically. They're not going to gain or triple or whatever their birth weight. No, none of that. By 2, they're half of their adult. They gain weight slowly, and then they get slightly taller. It's that what called step. Ever see a toddler, all of a sudden they look pudgy, then all of a sudden you turn around, they're taller. And then they get a little pudgier, and then they get taller. And it's just this thing that we always see. The head, again, at this point, should be equal to the chest or should be smaller than. And if it's not, we'll look at it. As we get older, all of our body systems are working better. Our heart rate's going to be lower. Our blood pressure is going to be more effective. We are starting to learn how to hold our urine, getting potty trained. All of these things we're starting now. These children are all about everything in the mouth, right? So you see upper respiratory infections, otitis media, tonsils. This is all the mouth, everything in the mouth. I call it the age of swapping spit, especially if they're in daycare, right? One toy to the other kid, to the other kid. And you're like, oh, they shouldn't, maybe. Listen, they need to get germs, so they build up defenses so that by the time they get into kindergarten, they've met a lot of these viral infections and they have a stronger immune system. I know it's hard to see our kids sick. And I know daycare, they're sick every other week. I get it. I see it all the time. But it's part of what they need to do. Their gross and fine motor are getting better and better. Coordination is a lot better. Their depth perception is getting better. They're able to use, their hands and do things, and they can throw balls and they can walk up and down stairs using both feet by the end of this toddler. They're getting more and more, they're getting bigger now. They're not as much baby, they're becoming more defined. Their eyes, they're seeing better. As I said, their depth perception is getting better. But the one thing that happens with toddler is all of a sudden they don't like to eat much of any food. I always say that toddlers, you give them chicken nuggets, macaroni and cheese, and apple juice, and they're happy. They really don't want to eat all the other good stuff for them. And they barely eat those sort of foods at this time. There is a thing that's called physiologic anorexia, which means is they look like they're anorexic, they're not eating, but these children don't need that much at this time. They're not growing as fast now, and they become the pickiest of all picky eaters. So it is just part of what a toddler is. How much food is wasted on toddlers? I couldn't even tell you. Here, try this. Here, try this. Here, okay, you want that? And you're trying to get them to eat and they really don't want it. They love to play with stuff with their hands. Their food in the high chair. This used to be the time where my kids, right before, after dinner, I'd let them play with whatever was left there. It'd be head to toe, all over the high chair and right into the bathtub. It was good for them. It's the exploration. It's being creative, with the food or whatever they had there. So Erickson talks about autonomy versus shame and doubt. What does that mean in a toddler? Autonomy is what you let those kids do by themselves. It's easier for a parent to dress them, to feed them, to put their clothes away, their shoes away, their dishes in the sink. But kids need to do that. They need that autonomy to feel good. The shame and doubt is when the parents don't let them try. For instance, and I'll give you a great example. I would always do everything. I wanted to do it. You make it easier. It's easier to get it done. It's less time. And my husband is not that way. He likes to give them a chance to learn and to understand. And this kid knows, at 3-year-old, he could change batteries that had a screw thing on the back of toys because he allowed this child to do these things. He just didn't do it for him. He made him go get those 2A batteries, and he would come back and give him the 2A batteries. So it gave him that sense of autonomy, and he feels good about it. It's that shame and doubt is when me, who would just go ahead and dress them or feed him, where he could do these things by himself. They need to get that done. Toddlers must be on a schedule. Ritualization. What does this do? It really gives them a sense of comfort. They know what's coming next. They know when they're getting a bath. They know when they're going to get breakfast. They know when they're getting a nap. They just know what's coming next, and this is comfort for them. And they also are starting to understand what is wrong, what they can't do, and what they're going to get in trouble for. The cognitive development of Piaget, again, exploring the world with their hands, their mouth, and moving things around, seeing it, having a concrete view of what's going on there. It is what we call active experimentation. And I'm going to go on to that one after this and show it to you. Again, Erickson's just what I said. Don't be that restrictive parent. Let that child do as much as he can. And even if the shirt's on backwards and inside out when they try to get dressed, it's an accomplishment, and they should be rewarded as an, oh my God, what a great job, good. Next time, let's try to get it this way, but never put the kid down. Sensory motor and Piaget. So Piaget says that all of a sudden, somehow a finger went in the mouth and it found it pleasurable. So now by himself, he'll put it in the mouth. Another thing, he goes and finds a rattle, holds it, picks it up, and he finds that there's a noise. So now he does it by himself. So things happen by experimentation, but they learn. Another one is they get older, and I like this one with bottle on the floor. Mom goes in the kitchen and the kid's there in a high chair, and the kid wants mom to be there. What does he do? Takes a sippy cup and throws it on the floor, and loud enough that the mommy hears it, so mommy's going to come back and take care of him. He didn't want mommy to leave. So he knows how to get mommy back there. I mean, kids train us. We're really trained. Children train us. And if you don't think an infant doesn't train you, let me tell you, they do. They're very smart. So pre-operational, as I said, is all about everything is concrete. They see it. They know it's going to happen. And when you get to concrete operational, now you've seen it. Now you start being more logical with it, expanding upon it, thinking about it and use it in different contexts. And those are the two things, pre-operational and concrete operational. They're starting to explore their bodies, body image, seeing what's going on, and they are going to start touching their genitalia. And parents should allow them to do and touch and feel it's their body, but not make it a bad thing. Now, if they're in public, you would say, hey, don't do that here. When you get home, you can go to your room, you know, just to make it as a okay, whatever. Because, you know, when you bring the attention to them, then they're ashamed of their body, and they don't need to be ashamed of their body. They're starting to learn that there's boys and girls. They're starting to learn that I have a penis and Nana, you have a vagina. You know, he walks in, you're going to the bathroom. He said, well, you don't have a penis. I'm like, no, I'm a girl. And finally they get it. They do know mom from other people. You know, the mom is their biggest female in their life, or Nana, like I am. And these children with social development, you know, needs sometimes explanation and comfort to get them there. These transitional objects would be like that teddy bear. My grandson, he had this blankie that he would want this blanket. He would just touch it and feel it, and he would rub it on him, and that would give him comfort. And then he had this little stuffed animal. It was a giraffe, and he just, you know, couldn't go anywhere without that. And it was his comfort. Their language gets so much better. You know, they're starting to be able to express what their needs are. They're getting really, really starting to understand. They want to be independent. They want to feed themselves. They want to play most of the time by themselves. They want to dress. They want to undress. They want to do things. So giving them that opportunity gives them a great feeling. And they start to understand if somebody else hurts, if they don't feel good. I know that, you know, I have rheumatoid arthritis. And when my little grandson was about 2, I had some ice on my knee, and I was really bad. I was having a really bad flare. And he came over to me and he asked me, why did I have ice on there that was cold? I said, it felt good because my knee really, really hurt and I couldn't move it that good. So all of a sudden he comes back later and he kisses my knee and he says, make it all better, Nana. You know, it's like these kids do understand and they do have concern. Again, play is so important. It really helps them think, and it helps them imagine things. And, you know, it starts that logical thinking and all this about play. And make sure as parents, teaching parents, you know, have age appropriate toys. They're going to be toilet trained when they're ready. I think the picture of this little boy backwards on the toilet saved me. I can't tell you how much cleaning up in the bathroom, because his penis went in the toilet and he urinated in there, and he would take it and play with it and make circles and move it around. And you know what kids do. Now, the other way around, he would be peeing on the floor, or half of it would go on the floor. So I really enjoyed that picture. And actually, the day I started teaching for Fortis, the day before grandson was born. So it was, as I'm learning, you know, pediatrics to teach it, I had a brand new grandson at the same time. So I thought that was pretty neat that the course gave me that. These kids, we know, temper tantrums, they're going to not wanting to go to bed is one of them. Another one is in the grocery store. If they're walking around, they lay on the floor and start, and you know, what do you do with temper tantrums? Well, I ignore them unless it's going to hurt them, right? Even in the grocery store, I'll walk away. If they want to have a temper tantrum, they didn't get their cereal or they didn't get the toy or whatever it is. Okay, well, I'm going to go. When you're ready, come on over. And bedtimes there. Can I have a glass of water? Can I have another kiss? Will you read me another book? I need to hug daddy. It goes on and on and on. There's always a story there. Negativism, as in no, 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 me do, mine, 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 mine. That's all part of them. And children up, even adolescents, I think even adults, we get sick, we don't feel good, something happens. We want to be hugged. We want, mommy to give us a cup of soup, or we, as in children, toddlers would go back to maybe sucking their thumb and they weren't doing that anymore. Or maybe, they go grab their younger siblings' bottle, want to drink a bottle when they're, have been on a cup forever. So they do regress, and it's part of the way they deal with stress. So gross motor development, I just went over these things again. These are some concepts that you'll see within questions. So social, we know 1 year, 1 word, 2 years, going to be multi-words, and they're going to start taking care of themselves a lot more. Now you see that little black and white picture of that car seat? I remember my little brother in one of these, and it was in the front seat. And it would be me, and I was 2 years older. So it would be my dad driving, me, and sitting down on the seat, and then the car seat would be next to him, and my mother would be sitting next to him. They had these big cars back then. Look at the evolution of car seats. Remember, car seats, we do not want old ones. They shouldn't be, more than a couple years old. They do have expiration dates. You can get one from your friend that that wasn't in a car accident, less than a year old. Yeah, sure. New ones, of course, or one that you used on an older child that's like a year or two old. Okay, fine. But be very careful with getting car seats for your children. And then preschoolers, ages 3 to 5. So the thing about preschoolers, this is that age where many of them go to preschool. These children now are getting prepared to go to kindergarten to learn, and to be, learn reading and writing and arithmetic and all of this. Some of the things that as parents we need to do is to get them ready. We get them ready by telling them how great school is, and it can learn really good, and reading to children. I mean, this grandson, Christian, his mother reads like 4 books every night to him. But my daughter, she reads books too. So it's something they do together. And now he's reading the words. He's just into kindergarten this year. And this kid is reading words, big words. That's quite amazing. And the first word he ever spelled was Blippi. And it's 6, Blippi, 6 letters. And he just wrote it in chalk in the backyard. I was like, how did you know that? And it was a repetition of the show. So I thought that was pretty insane. Going to be a smart little kid. I got to be prepared. So school, getting them ready to be able to sit, to pay attention, to get along with another adult, to get along with other children. It's hard, but this is what we need to do and promote. And if they're not in school, put them in an activity that puts them in maybe, gymnastics, or put them in, ballet or sports, so that they're learning how to do things, paying attention. Preschoolers, again, grown real slow. 5 pounds a year, 2 inches is not that much. And again, the body systems are getting more and more mature, and preschoolers need less of a routine than do toddlers. Gross motor, get up, go, go, go movement, walking, running, climbing, jumping, 1 foot, 2 feet, don't matter. They're doing well. Fine motor, it's eye to hand. It's dressing themselves, putting it on the right way, knowing where the tags are. It's coloring in the lines. It's buttoning a button with the little fingers, okay? These are things that gets more and more mature as they go. Now, Erickson is developing a sense of initiative. They know that they have a certain behavior that they need to perform. And they feel bad if they're not going to. You know, in a way, it almost sounds like Kohlberg because they're learning right and wrong, but it's a little bit different. They're learning that they should always do right. Their super ego is part of what they do. Again, I talked about getting them ready for school, Piaget. So we talked Piaget, very similar to your toddlers. Again, this is now where they have to learn things concrete. They're starting to take this concrete learning and now being more logical with it, knowing that, oh, the book is read and the car's read, and it doesn't matter that if it's a book or a car, it is still read. This is logical. They're getting speaking more words. They're understanding this magical thinking. Ever listen to a little 5-year-old play with themselves? They're with their toys or trucks and they're moving, they're talking to themselves and making up their own little fantasy world. It's actually fun. And they don't understand time by 2 o'clock in the afternoon. They understand after lunch, when you wake up in the morning. My grandson understands I'm going to stay with him 2 morning times. That means he's going to wake up 2 days and I will be here. And that's the way it's understood. So it's time with events. And Kohlberg. Kohlberg is that there is right and there's wrong, and there's a consequence for each. You can be right, do something right, and you'll be praised. That consequence is, wow, great job, let's go get a treat, right? Wrong is the consequence, could be timeout. They're starting to learn about sexuality, males and females, the differences. You know, they become more modest. They don't want to be seen naked like earlier ages. They're running around the house naked. They don't care. But now they don't even want you to come into the bathroom. They're modest. They're starting to, you know, explore their penises and vaginas and even getting more into masturbation. The one thing that as healthcare professionals, and I've actually walked into a room where a little girl was sort of rubbing on a stuffed toy, like masturbating, like rubbing it there. And I went, you know, Mom, I'll be right back. I walked out of the room, waited 5 minutes, walked back in. I didn't want to draw any attention to it, and I didn't want the girl to feel bad about it. And I wasn't going to do that to her. As I said, ritualism isn't as what it was. They can dress, they love to please, they want you happy. You know, they'll do things just to show you, you know, and want that praise is basically what they want. They're following what the family is, what their culture is. You know, if they understand going to church every week and Jesus and the Bible and all of that, they're going to understand that. Or maybe they just understand Christmas is a Christmas tree and presents and Santa Claus. Whatever your rituals and values are, they're going to understand it. They do challenge your code of conduct. They're going to say, but I can stay up till 8 o'clock and it's only 10 till, I get 10 more minutes. And you're like, no, you're going to bed now. They're going to challenge you. Types of play, again, associative is playing together with no rules. We know that cooperative play is there's going to be rules and there's a way to play it like a game of checkers. You know, imaginative play, imitative play, and we use, again, dramatic play is used more in the medical situations where we need to find out what happened to that child. And through using toys and whatnot, we can see what sort of, usually it's abuse. They're afraid of the dark. They don't want to be left alone, and they don't like large dogs. They're afraid of them. They're afraid of ghosts. I always say, oh, is there a ghost there? Why don't you invite them in so I could say hello to them? Go to your bedroom, go get your jammies. And no, it's dark over there. There's ghosts. They're going to get me. I'm like, well, if there's a ghost, why don't you, invite them over here? Let's play a game with them. So they also understand who gives them pain. Who does? Healthcare providers, right? We're always giving them a shot or something. Sex education, when we're talking to these preschoolers, find out what they know. Don't try to give them a big explanation they probably don't know. Make it as simple as possible before we go into that. And we've already talked about the fears. So who wants to win a cahoots today? Look at you all. Good job. Megan, Oasis, and Amber, and Nicole, and everybody. I love it. All right, everybody wins. There you go. There are 55 of them. We should be getting out about 10 till, I hope. 603-7504. All right, let's get going so we get out of here tonight. Week 2, infant, toddler, and preschoolers. A multi-select. Types of play considered to be sense pleasure play. Sense, right? Sensor motor. What does it touch like? What does it feel like? So anything you play with your hands, and even like things on the faces, it's all that touch stuff. Sand, finger painting, mud, water, stuff that you play with. They just love to do it. Sense, pleasure, play. What type of play is considered cooperative play? Cooperative play is when you play a game and there is a goal. You win doing something. A great explanation is checkers. We were just playing that little pop-up game with the little things that go around, but it was Paw Patrol. This kid won 2 times and he didn't cheat. He's a good player. According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reasoning. Well, what does Kohlberg say? What is this big thing? So Kohlberg, good and bad and a consequence for either. Simple. Whether it's a good consequence is a praise or a bad consequence, you're on timeout. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So you have a preschooler, ages 3 to 5. Let's say they need to go have surgery or they need to go get a radiological procedure. You need IVs and catheters, and it can be scary. So to make it less stressful, we're going to use a doll to explain the procedure. Remember, before we walk into a toddler or walk into a preschooler, number 1, minimal touch. Then you get on their level, on their developmental level, and break the ice. Then you let them play with stuff or a doll to explain the procedure. Don't go in with a doll and try to explain it without going through those steps. The kid's not going to listen. A multi-select. What are some findings from a pediatric physical assessment? So these are things you can touch, you can see, you can feel, you can hear. The one thing I warn you as you're going through and doing questions and NCLEX and going through with exams and quizzes, read the question and see what they want. In this case, physical is growth, body, and temperature. The history is a history. It's a difference. Good job. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? You know, working in an emergency room and having a constant turnover of children was difficult, and especially if the kid don't want to do anything for you. So I had to learn this quick. Number one, minimal physical contact first. Then get on their level, go, wow, man, you've got cute curly hair. Or where'd you get those blue eyes from? Or are those sneakers fast? Do you run quick? You know, when you're with a toddler, you're with a preschooler, these are things that'll break the ice. And then you start playing, okay? There's a way to go to it. What would you suspect if you note that an infant's chin is quivering, their fists are clenched, and they're inconsolable? I mean, you might even see them shaking their head and banging the side of their head. All of these things, they're telling you something. They can't talk, so they got to show you what's happening. And this is pain. This is pain. This infant's chin, the fist, and the inconsolable, absolutely pain. And that bang in their head is telling you the location, probably an earache, probably an ear infection, otitis media, okay? A multi-select. Erickson describes infants as trust versus mistrust. What does trust mean? So trust is when they know what's coming and the needs are met. That's number one. But that makes them feel secure, and that gives you the happier child. It's all part of the package. A 3-year-old child's having an outpatient procedure. How would you help the child to be less fearful? Give them a doll, let them know what's going on after you did nothing at first, then broke the ice, and then you start with the play. A multi-select. You need to do an assessment on an infant, and you walk in the room and the infant's asleep in the mother's arms. What are you going to do? I used to love it when I see an infant asleep. Because I'm going to listen to their heart and lungs because they are quiet. Come back later. Oh no, this is a perfect time to do an assessment. And there's no way I'm going to do anything to wake up that child. They're comfortable. Listen to them in the parent's arms. When do you switch formula to whole milk? "12 months is when you do that. At 6 months, you introduce food. Whole milk is at 12 months. And it's all that fat is they need that extra fat. A multi-select. When teaching about car seats for a newborn infant, So they can use a gently used car seat from a friend less than a year old because you know if it's been an accident or not. Of course, rear facing in the back seat. You know, you switch them to front facing at 2 years old. You don't have to be 30 pounds. You know, Christian was only 24 pounds at 2 years old. He was a peanut. But I checked into it. It's the muscle development at 2. That's when you turn them front. The other thing is any new car seat for sure, but old ones that even they're yours, no, they're not good. A multi-select. When and how do you introduce solid foods to infants? That looks like my son when he was an infant, he was a little boy. Always head to toe in his food. He's now 6'4". Big boy. So you introduce them at 6 months, one at a time, and it's 4 to 7 days before you introduce a new one. Very good. Before assessing a 4-year-old child, what techniques would you use to approach this child? So you're going to tell them something like, wow, Batman, what a cool t-shirt. I mean, I might say, oh, I just got one for me and my grandson. I love them. Or your freckles are cute, or your hair, or your eyes, or whatever. You find something to talk to them about, and now you are not threatening. You've got on their level, and start the play and let them play with the whatever you need to get done.
Is she frozen?
Yeah, I think she's frozen and the game is frozen too.
Looks like it.
She disappeared.
Hopefully she's not able to get back. Man.
I don't know, but I was third. So if it makes us restart the game, I'm not going to be happy. No, 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 no. And it keeps saying reconnect, reconnect. Ay, Dios. I actually hope that she gives us access to these Kahoots because they're really good.
Yeah, they're really
Really
good.
good practice questions. So
They are.
I
So
hope.
they're all on her YouTube channel already. She
Oh,
just
okay.
modified. She already
Yeah.
modified them though. So like the one with the heart sounds and like with a multi-select on the YouTube channel, it was only just one single question. So it was like check respiratory status, but then she modified it to add heart sounds. So she changes them semester. The lady's
okay.
smart.
Yeah.
You
I
said
really
that
like
they
her.
were on the
I think she's
YouTube-
really good. I like her.
They're on the
Yeah, me
YouTube
too.
channel? Me too.
How can we find those channels?
You
On
have
the
to look, you go
You
to
showed it to us in
name.
in Canvas when she gave us the math. So that's her channel. So just hit all videos and she has every video in there.
You send the YouTube link. She
Thank
sent
you.
it one of the announcements.
No,
She's-
in Canvas is a message for like math help.
Inbox. I think it's inbox, right?
Yeah, inbox. Yeah, inbox. And she attached the YouTube channel at the top.
I also don't remember our class being this small. Like, right?
Maybe they changed because Darlene had posted if you wanted to switch classes, you could. Maybe some people left and went to different days.
I know
Yeah.
some people in Capstone that they told me that she's the best peds teacher.
Everybody has told me that too. You won't worry about me.
This is the only time she does this class too, right?
I think so. I
Yeah,
think
'cause
I
I
haven't
wasn't
seen any other times for her, but I like her. She explains things in a way where it like clicks, and I'm like, okay. And I
Right.
want to meet her grandson too, because she talks about him all the time.
She also does, she also has a Monday class.
Oh, okay, Monday.
Oh, Jada, we got class on Monday, so we couldn't do that.
We're gonna be
so
right
that's
in this
another big
Tuesday
campus.
class.
Med Surge too.
I hate community classes.
I hate community so much. Oh my
It's just busy work. I took it last term. It's busy work. A whole lot of busy work. Just do that window survey now.
Oh my gosh, week 1 and there's already a paper due. And then the group breakout rooms, I don't understand. Are we doing the case study? Are we breaking down the chapter? I don't know.
Busy work. That's it.
Megan, were you in Price's class just now from 6 to 8?
Yes.
Okay, I was with you, so I showed up late. And she said she sent me an email. All she said was we're in a breakout room. I
Right.
was like, what is that?
She makes me so confused. And I'm like, oh my gosh, am I paying attention? I read her announcements, I do her work. I just don't understand. I don't understand. It wasn't until today where I actually was able to get into the textbook because I was gonna buy it for $40. And then I was like, okay, no, I'm doing something wrong because
So when they do the exam reviews, it'll all click, but not till you get an exam review. Like right now, it's just like, okay, what is she talking about? What are you talking about? But then once the exam review come out to review the exam, it'll make more.
and she hasn't sent it yet. And our exam is next week, which I don't know about you guys, but Monday we have a med surge exam.
Yep.
So it's, oh my God, my brain is a
Yes.
fucking fried egg and I'm gonna cry. So yeah.
Don't forget clinicals.
Don't forget
The
who?
what?
Clinicals.
Oh yeah. But I
Oh.
feel like clinicals is the fun part. The only thing is like waking up early is like, ugh. But once you see everything and you're in action and you're like, okay, this isn't bad. I like this. I think I'm gonna be a nurse, you know?
Oh.
¿Hasta cuándo nos quedamos here? Oh my goodness.
Can we do like a 10-minute rule here? If she doesn't log in, we can all log out. No.
The rules are not for us, it's for them. The exception is for them, the professors.
Remember, we're being recorded.
Yes, we are.
I think we all forgot about that part.
We're all really tired at this point.
No, but it's true. Should we just stay here or leave and then try to come back? Or
This is
I
class
think-
time.
I think
don't
I
know.
kicked us off at like 9:10, 9:15, I want to say.
Does nobody has her number? Didn't she put it on the
She
announcements?
did, but I didn't take it down.
Hold on,
Let
let's
me
see.
check her announcements.
I'm texting her now. I'm
Oh,
waiting.
okay, perfect.
Okay, thank you.
So she said her electricity flashed and her computer shut off. She'll send the recording and she can't get back on. So I just asked her, did she want us to log off and see her next Tuesday? She said yes. And she gonna send an announcement about everything that's coming up, I guess. So bye, y'all.
Bye. Thank you.
Bye.
Bye, thanks.